Hello, Dr. Bridget Solomba Malewezi here. Today, wanted to cover a topic that has come up quite often, especially most recently with Omicron and a lot of people being infected, is the issue of people who are continuously getting repeat positive tests and what to do about it. I've had this question come up a lot from a lot of people, especially organizations and companies trying to see when staff can come back or even students in schools. And so this is an important conversation in terms of both addressing what is going on and how to go around it if you have that kind of situation. So, most people, as we are aware, if you have had a positive test for COVID, you are recommended to isolate for at least 10 days. This is the Malawian guidelines. We do know there's other countries like the USA who have reduced their isolation days to just 5 days. However, in the Malawian context, the guidelines have not changed. So if you get a positive test, you're advised to at least isolate for 10 days, especially from the last symptoms. So the 10 days you start counting from the onset of your symptoms or when you had the test. So if you test today, you count that as day 0. So tomorrow will be day 1. Whereas if you had your symptoms, again, you start counting from when your symptoms start. So again, you revert to day 0. So this is important, and I know a lot of people do manage to do that. And generally, most of the time, the guidance is that if you remain symptom-free, you can go back to work or wherever you were meant to go to and come out of isolation. However, especially for settings like organizations and companies, sometimes they are requesting a repeat test. In general, the guidance does vary, especially depending on the availability of testing in country. However, what we do know is that for those who have a repeat test, most will get a negative test result, and that's great because that shows that you you're cured of the infection, both symptomatically as well as by lab confirmation. However, we do know also that there are a number of people who continue to have a positive test result, and this is often challenging because you're not sure is the person infectious or not. So the first issue, one thing that I've been guiding a lot of organizations is that this is something that is very common, especially for people, and one thing to reassure yourself or anybody who's getting these repeat positive tests is not to be downtrodden. It's actually a very common phenomenon that we are seeing in COVID all throughout from the first wave onwards. There's a lot of data that is coming out and trying to test for people who are getting repeat positive tests. So it's not new. It's not anything to do with you as a person. It's just something that is going on. We're not quite sure why some people are getting these repeat positive tests for a long time. Actually, what we do know is some people continuously have positive test results for 3 months on end. So this is challenging. And so what I'm providing as guidance to a lot of organizations, and it's also something that the Malawi government instituted around 2020 as well, was the use of DNA PCR for your repeat test. So for example, if you have a test and you need to go back to work and you need to get a repeat test, it's always advisable and better to try and get that done as a PCR test. So there's 2 types of tests: rapid tests. They are quick, they get the results immediately. You can see your results. They sort of look like the malaria test and all the other test kits. So those ones are pretty easy. Your results will come back in 3 or 5 minutes immediately. The PCR is different. It's a different type of test. This one takes your sample, it's put in a machine, and the machine actually converts. PCR is a way in which they take the genetic material and they try and amplify, sort of replicate it and make lots and lots so that they can see if it can detect anything. And so it does this in cycles. And so what happens is that it's more sensitive because it can pick up, because it actually is replicating and creating more and more. And so it can pick up even the tiniest level of virus. So that's why a PCR is like a gold standard, because it is able to do that and detect these low levels. However, we also know that it's then able to give you what is known as a CT value. So my guidance right now to a lot of organizations that have asked me about this issue is, if you're trying to get your staff member or a student come back to work, to school with a negative result, advise them to get a PCR, because that's easier. And I will also explain why it helps you detect and determine whether they can come back. So the repeat test can be done. When it's done by PCR, it will tell you whether it's negative or positive. if your staff member gets a negative PCR, you're fine, they're good to go. If they get a positive PCR test, that also helps you to determine whether they're still infectious or not. And usually what we're trying to utilize is what is known as a CT value. So remember, I mentioned that the PCR, what it does is it takes the sample from the swab, it puts it in a sort of a petri dish, and it starts to replicate. So it does this in cycles. It does a cycle, and then it checks, and then it sees, can we see the virus? No, so it does it again. It replicates some more, it checks, how can we see the virus? No, and then it keeps doing this up to 40 times. So this is called the cycle, and then basically the CT value is the value at which it is able to detect a positive result. So you can imagine if you have lots of virus in your body, you will end up, the test will pick it up pretty quickly. So the cycles, the number of cycles that it needs to detect the virus is lower. So in essence, when we're looking at the CT value, a lower value means that it is, you're more likely have a higher viral load because it didn't take long for the test to find it, right? If you have 100 viruses, if it replicates 100 and creates 200 copies, then in those 200 there's about 100 other virus components. So essentially it was easy to pick it up because there's just so much more. But imagine if you, out of 100, you only had one. It takes a few more cycles, a lot more cycles for the test to detect, and that's why a CT value has been quite a useful sort of measure to try and detect positivity and to understand how positive you are. The cutoff for CT value that we're using in Malawi is 30. So if, for example, somebody in your office has a repeat test result, but their CT value is 31, that's likely to be interpreted as negative or less infectious, so they're likely to be able to come back to work. Whereas somebody who has a CT value of 5, that's very high. It means that the test only ran 5 times before identified that, so more likely they actually have a higher viral load and more likely to be infectious. Now, CT values have to be interpreted cautiously. It is a raw measure that is helpful, especially in these situations that we're talking about, where somebody might have a repeat test and end up positive. If the repeat test has a very low CT value, you might consider sending them back to isolate some more. Whereas if they have a high CT value, you might think they are able to come back to work. So that's how you can utilize this figure. However, just to practice caution that the CT value is not static, and it does change from test to test or lab to lab. So for example, if you go to Partners in Hope, you might get a different one. If you go to KCH or another lab, it might get a different one. But again, as it's a raw measure, it's a sort of a measure that is helpful. And again, sometimes we can see that even the same person tested same time on different times might get a different value. So it's not a very static, it's not like now that I'm 26, I'm going to be 27 tomorrow, or and so forth. So it's just a basic measure that is being helpful, but it's not sort of everything. So most people do say we should look at these CT values with caution because of all those differences that can happen. But if you're an organization or a school that is trying to get people back into campus or back into your organization, this is something that you could consider. Get your people retested for using PCR because it's helpful. You can use that CT value again. Another issue, as I've mentioned though, is that sometimes we do get some people who continuously get positive results. So maybe they've had that CT value 20 and then they come back, it's 21. Next time they come back, it's 25 over a long period of time. I would advise that after a repeat CT, after a repeat PCR of over 2 or 3 more weeks, or after 3 weeks, you really shouldn't start to worry about it. I would advise, unless they've had a very severe illness. For those people who had mild or asymptomatic disease, most of the studies show that after 10 days, you're not infectious anymore. So even the use of repeat tests in some countries, like I've said, the US has even scrapped the use of repeat tests because of that reason, that they thought getting a repeat test isn't really of value. You might get these people who continuously have positive tests anyway, but they're not really infectious. So the CT value is helpful. It's not everything, but you could use that if you want to have something organizationally. However, again, after 2 or 3 repeat PCRs, honestly, that person is unlikely to be infectious and can come back to work or come back to school. So although they still have a positive result, it's not useful to keep going on, because there are people who continuously up to 3 months and the genetic material that they have is not infectious anymore. So that's the general information and evidence that we're finding, as well as that after 21 days or so, most people are not infectious at all, even the ones who had severe disease. So it's unlikely that you will need to have 5 or 6 PCR tests after a period of time, 2 or 3 few weeks, you're likely to be fine. So hopefully this is helpful. This was a long post, but hopefully it helps you understand for those people who've had repeat tests that are positive for a long time. Just to encourage those and to those people that it's not a bad thing. You will be okay. It doesn't mean that you're still sick or harboring anything. It's just the way that this virus is working, that sometimes some people continue to have some virus particles, and most of it is not infectious. I hope that has been helpful for all of you, and continue to get credible information from reliable sources. Thank you.